This week, we examine what some are calling a growing national crisis, the shortage of school nurses. Only 3 out of 5 schools across the country have full-time school nurses. This often forces school administrators with no medical training to step in and provide some level of care. Hillary Lane is here with the potential dangers to students when no nurse is available. Hillary, good morning.
John, good morning. The role of the school nurse is more critical than ever, with a quarter of all young children suffering some kind of chronic illness like asthma and diabetes. Over the past several years, multiple children have died after facing medical emergencies in their schools when no nurse was on duty. Parents and nurse advocates now want to see that changed.
Did the school district fail your child?
Yeah, they failed them always. They weren't there to help him.
Last October, Rasheen Presley's 9-year-old son, Hassan, collapsed in the school cafeteria. He was rushed to the hospital where he was later pronounced dead of heart failure. What went through your mind in those last moments?
It was my only son. I want nobody there to help me. Nothing.
There was no school nurse on duty that day. According to a Philadelphia school district official, staff certified in CPR tried to revive Hassan, who'd been born with a heart defect. It's unknown had a school nurse been there that day if they would have been able to save Rasheen's son. Do you think things would have been different if there was a school nurse there that day?
I think so. You never know.
Kareem Presley is the boy's uncle.
It's the hardest. You just gotta be tough. It hurt me because he's not here.
Did Miss Millie talk to you before?
There are no federal laws regulating school nurse staffing, but the American Academy of Pediatrics recommends at least one registered nurse in every school, a standard many districts are failing to meet.
That is a crisis.
Donna Mazik, the executive director of the National Association of School Nurses, says 40% of schools across the country don't have a full-time nurse, and 25% don't have a nurse at all. Is that acceptable?
It's not acceptable. Students deserve what they need in order to be in school and ready to learn.
Mazik blames shrinking budgets for the shortfall, which she says increases the burden on existing nurses and puts kids at risk.
If you have a workload that doesn't enable you to care for the students in the way they need, it's like drinking water from a fire hose.
So now time for school number 2.
Yes, we'll go to Bushy Park Elementary School.
Deanie Gorby-Crease is a school nurse in Howard County, Maryland, who covers 2 schools a day.
I'm often stressed because I have to figure out the safest way to balance it.
She has health assistants at each school who call her with questions when she's not in the building.
If I'm busy with an emergency at my other school, I'm not available right away, so it might delay their care some.
As a school nurse, do you feel like you're stretched too thin?
I think so. I would love to be able to be in one place so that I could provide the care that the kids need. I also think that I would get to know the kids a lot better.
Look at my nose.
In Cincinnati, Ohio, where nurses were also sometimes covering more than one school, they're tackling the problem through a partnership with Cincinnati Children's Hospital.
We now are able to provide routine primary care services for all of the students in the building as well as any child in the community.
They've opened health centers in schools to close the gap.
So students get services here no different than they do in a pediatrician's office.
In the wake of his son's death, Rasheen Presley says schools must find a way to provide care for all students.
If you ain't got no nurses at the school, you might as well teach your kids at home. That's just common sense.
The Philadelphia School District is working with a local hospital to determine if and what kind of additional health support is needed in the schools. And next month, a bill will be reintroduced in Washington called the Nurse Act. It would provide grants for schools to hire nurses.
Good. Our priorities need to change. This is an issue.
Heart goes out to the Presleys. Listen, they said, listen, we don't know if the nurse would have made a difference, but at least you would have known everything would have been done to help them try.
Thank you.
And that's what's so upsetting.
They say a school nurse just should have been there.
Exactly.